Welcome everyone. This is a training and refresh about an overview of Pennie. What is Pennie? Pennie is a brand. Literally, it's a simple brand, a simple name that we came up with because our name is the agency is the Pennsylvania Health Insurance Exchange Authority. So it's a very long name. We came up with Pennie, which basically is the PENN as Pennsylvania, I as insurance, E as exchange. That's how the name came out. So when someone asks you what is Pennie, now you can share with them that Pennie is the Pennsylvania Insurance Exchange. We call it marketplace as well. So welcome everyone. Pennie gets you cover. Few important notes about where Pennie came from. What is the origin of Pennie? So a team of legislators, lawmakers here in Pennsylvania got together and were very concerned about how to improve the access to healthcare in Pennsylvania for the residents of Pennsylvania. And they decided, right, that they want to present a law. So this is very interesting because it happens in 2019, only 3 years ago. Our agency is really new, where unanimous and bipartisan effort from this legislator passed a piece of legislation that took the state of Pennsylvania away from the federal marketplace called healthcare.gov. So Pennsylvania create their own base marketplace, a state-based marketplace. But this is important, and I wanted to show the picture because there were legislators from both parties, and this passed in both chambers of the General Assembly in Harrisburg. We have the support of Republicans and Democrats to get Pennie created. Very important for everyone to know that we work with everyone here. What is important is to get people protected, but it's important to know what happened, how do we get to this point that we create Pennie. So that piece of legislation has two programs. One is set up the state marketplace. We have a local control, we have a local people, we have a local marketing efforts, we have outreach, we have assisters, we have brokers, a lot of resources here in Pennsylvania for Pennsylvania. But most important also for the customers, for the consumers, we were sending about $100 million a year to the federal marketplace. Well, Pennie is working with literally a quarter of that, and the rest of the money literally is going to a second program or second part of that piece of legislation, which is the reinsurance program. That money literally helps to keep in the individual marketplace the rates lower. So the first year the Pennie came out, we reduced in 5% all the rates of the health insurance plans. That was very important because usually they go up. The second year, other 5% reduction. So this is helping already to stabilize and reduce the rates of the individual marketplace. But most important, because we are a marketplace, there's a healthy competition. Pennie is the marketplace. Pennie's like I said Pennie's like the supermarket. You go to the supermarket, right? At the entrance of the supermarket, they ask you, hey, where do you live? How much money do you make? Who's gonna need insurance? And then we will tell you with that, we will give you a coupon at the entrance of the supermarket. So that coupon is what we call the financial assistance. With that financial assistance, you go to the supermarket, and now you have the opportunity to apply that coupon to different health insurance plans that are in your area, in your zip code. So that's what Pennie does. So we are the marketplace, we are the supermarket, right? And what happened is we have these different insurance companies that are creating competition among themselves. Give you an example. In the Philadelphia area, there was only one company before in health insurance, providing health insurance for the individual market. And now there are 4 different options, 4 different insurance companies. So good competition, healthy competition at the end helps to improve the services and reduce the rates of the health insurance. So that's why the Pennie, the piece of legislation was so important for all of us. If you have any questions, feel free to chat, to put it in the chat or unmute yourself, as we go with this presentation. What is our goal in general? Is to improve the accessibility and affordability of the individual marketplace, because it's not accessible, it's not affordable. So that's what Pennie does. We are the official marketplace in PA. We're a government agency. This is important. We work for the government of the state of Pennsylvania. So Scott and I, we are here to serve. We get paid with tax dollars, literally money, and our job is to help the people in Pennsylvania. That's what all the people here at Pennie does. So that part is important. Also, it's important that if you go to healthcare.gov and you enter your zip code and it says Pennsylvania, you will be redirected in healthcare.gov to Pennie, because we are the only marketplace in the state of Pennsylvania. Okay. What is also important is to know that we, Pennie, to be in that supermarket, in that platform, you have to have a very high quality health insurance, and they are affordable. But the most important is what Pennie does is we provide that financial assistance. So key things here: we are not an insurance company. Pennie is not an insurance company. Pennie is actually a government agency that provides financial assistance, so you can go and shop for health insurance and use that financial assistance to make things more accessible, more affordable. Okay. Now, who do we help? This is important as well. We help individuals and families without insurance from the employer. So let's say that you work part-time and you don't have health insurance for your employer. So you can come to Pennie and use Pennie. You are not eligible to be in Medicaid or Medicare. So Pennie can be a good option for you. So there are very important situations, especially in the immigrant community, where if you are not 5 years in this country, you cannot be in medical assistance, for instance. So if that happens to you, you can come to the marketplace because you are not able to have healthcare plans either in medical assistance or Medicaid or Medicare. You know, there are two big programs government that offers health insurance: Medicaid or medical assistance, and Medicare. Okay, Medicaid is low income usually, and Medicare is individuals that are over 65 years old. So if you are early retired, many of us bring our parents, okay, and they cannot be in Medicare because they are not 65 yet, 65 years old, they can come to Pennie and shop for health insurance and receive the financial assistance. If you work part-time, like Uber or Lyft, those organizations don't provide health insurance. Landscaping companies, construction companies, restaurants companies, where a lot of the Latino community works, they usually don't offer health insurance. So we invite them to come to Pennie. So we have a lot of people that are uninsured that we can reach out and explain what Pennie does, make them the importance of why you need health insurance, and then use it, the financial assistance that we can provide. If you are an entrepreneur, if you have your own business, if you are self-employed, accountants, musicians, someone that works for themselves, you can come to Pennie because nobody else will help you. Or same thing, if you have a small business, a little grocery store at the corner, a bodega, the owner can enroll individually in Pennie, and each of the employees can also come individually and enroll at Pennie. We do not offer group health insurance. We only offer individual health insurance. So I'm giving these examples to be very clear in who can we help, and there's a lot of people that we can help here in Pennsylvania. 1 out of 20 people in Pennsylvania don't have health insurance. And important as well is that you call Pennie or you call an assister, and if you don't qualify for Pennie, we still help you to get protected, whether it's with medical assistance or CHIP or Medicare. We have a policy that called no wrong door policy, or las puertas abiertas. That's what I always said. This is a policy of puertas abiertas. Anyone that comes here to seek to be protected, we try to help. So that's important. Now we have 374,000 customers. Is a lot of customers. We received 280,000 from healthcare.gov, but we have increased the number of new customers, and 90% of our customers receive financial assistance. 90% of our customers receive financial assistance. We talk about the high quality. Why is high quality Pennie, the plans that are on Pennie? Because they are aligned with the Affordable Care Act that has 10 essential health benefits that must be included in all our plans. What are those benefits? Outpatient services, emergency services, mental health, hospitalization, lab services, prescription drugs. There are at least 10 of these health essential benefits that are included. Many organizations or some insurance company offer just, insurance plans that do not cover all this. So they are already filtered. Those plans are already kind of filtered in our marketplace, so they are high quality health plans. This is important to know for our community. You cannot be denied due to a pre-existing condition. Our individuals under 26 can remain on their parents' covers, but once they turn 26, they are no longer. So they have to purchase health insurance, and that is also a market for us. All these students, community college students, university college students that turn 26, they are also, there's someone in the lobby, I believe, thank you. So all these individuals can also benefit from Pennie, graduate students, community college students, okay? Here's a picture, a map of Pennsylvania. We are a state agency, therefore we have to be aware of all the counties in Pennsylvania, but with blue, dark blue, we have highlight where the uninsured live. This is important for you guys to be more strategic as well, for us as well. So we identified that the area with more concentration of uninsured is Philadelphia, okay? 109,000 uninsured individuals live in Philadelphia. Big and high priority for Pennie. But same thing with other counties that are surrounded Philadelphia. And in the middle, we have Lancaster County, which is a very interesting county with a lot of reasons why people are uninsured. But they are there. And we have to figure out what those barriers are and partner with organizations that can actually reach out to those uninsured. But Pittsburgh, the area of Pittsburgh, and as you can see, everywhere in our state, we have uninsured. So that's what Pennie tried to do, try to reach out to them so we can actually protect the people and reduce those rates of people that are uninsured in our state, okay? I let Scott talk a little bit about the American Rescue Plan so we can change a little bit the voice here and we continue the conversation. Is that okay, Scott?
Absolutely. All right. And thanks a lot, Juan. Early in 2021, March 11th, actually, the Biden administration signed into law something that was very significant, and that was the American Rescue Plan. It did a lot to help the uninsured in Pennsylvania get protected. There are a couple things to note. Under the current legislation, the enhanced financial assistance that's available through Pennie because of the American Rescue Plan is in force for 2021 and 2022. A common misconception that a lot of people have is that at the end of 2022, financial assistance at Pennie will go away. I can assure you, we will have advanced premium tax credits, we will have cost sharing reductions, we will have our reinsurance program and competition in the marketplace, creating affordable rates. The enhanced subsidies, though, do a couple things, and they've really made a huge impact. The first thing is they provide more generous tax credits for 2021 and 2022 at all income levels. And that's really helped a lot of our friends and neighbors out. When it comes to a subsidy cliff that existed prior to the American Rescue Plan for those who were at or above 400% of the federal poverty line, they are now, for 2021 and 2022, for the first time, individuals who are $51,000 or more, or a family of four that might make 100,000, 105,000 actually, or more, they're in a position where they now qualify for financial assistance. And Juan alluded earlier that there are a lot of our friends, family members who may be older, who decide that they want to retire early, or they don't yet qualify for access to Medicare and Medicare options. This 8.5% cap of premium has really made a huge difference. And I'll share some scenarios with you here that can outline this a little bit better. The first scenario that we see is an individual who makes about $19,000 a year prior to the American Rescue Plan. And please keep in mind, Pennie has three different metal tiers: bronze, silver, and gold. All of these scenarios are based upon Pennie's second lowest cost silver plan in these markets. It's good insurance. For this individual, prior to the American Rescue Plan, for that second lowest cost silver plan, this person would have paid $66 a month for their insurance. Now, under the American Rescue Plan, this person and individuals like them are paying $0. So that's why when you go on to our plan comparison tool, which Juan will walk us through a little bit later, you'll see certain plans here at Pennie that are $0. Some have $0 deductibles. This individual saved $792 a year. And for someone who makes $19,000 a year, saving an extra $800, that's pretty good. The second scenario is a couple. They retired 1 year early. They're both 64. They make about $77,580 a year in their first year of retirement. And no, this is not a typo. Prior to the American Rescue Plan, this couple, to cover two people, would have paid $2,462 a month for their health insurance. Now, because of that 8.5% cap that we place under the American Rescue Plan, this couple, to cover two people, pays $550 a month. That saves them almost $23,000 a year. That's incredibly significant, especially when you're heading into retirement. It should be a fairly carefree time for you. Saving that much money can really make a huge difference. A more common scenario, and Vicki, this one hits home because it's in Allegheny County. There's a family of four. They make about $52,000 a year. Prior to the American Rescue Plan, this family of four would have paid $285 a month to be protected. Now, under the American Rescue Plan, this same family of four pays $87 a month, which is a little bit over $20 a person. $87 a month is comparable to a cell phone bill, a cable bill, etc. They save about $2,300 a year. They can put that to good use in their family. So the American Rescue Plan has had a very significant impact at Pennie. And it's something that again, with everyone, we are awaiting the legislation in Congress right now to determine what path is going to happen. There's a very good chance that these subsidies could go, or the enhanced subsidies could go away. But again, the impact has been measurable. Next slide, one. I'd like to take a couple minutes to address something that's pretty important. Most people think, when you think of a marketplace, you think of it being open and closed, and that's partially true. The one nice thing about Pennie is that yes, we have an open enrollment every year from November 1st to January 15th. And during that open enrollment, basically any uninsured person can come, they can get together with an assister, a broker, they can call Pennie's customer service line, and they can explore their options and their eligibility for financial assistance. But Pennie doesn't go away just because our open enrollment closes. Throughout the course of the year, we have what's known as a special enrollment period. That special enrollment period, next slide one, that special enrollment period is from January 1st to December 31st. And outside of open enrollment, individuals who have a qualifying life event, something like getting married, having a baby, losing their health insurance through work, they have the ability to come to Pennie through a 60-day window of opportunity where not only can they determine their eligibility for financial assistance, but they can also shop and compare plans, health and dental. The list that you see here is not necessarily exhaustive, but it represents a good representation of what these qualifying life events would be. Changes in household, again, getting married, getting divorced, having a death in the family, adopting a child, having a baby, loss of coverage. Loss of coverage could be through their employer. It could be loss of coverage through medical assistance. Maybe they make a little too much now to qualify for medical assistance. Well, that's a qualifying life event. And Juan had mentioned before that when an individual ages off of their parents' health insurance, they turn the age of 26 and they need to look for health insurance options. If they don't have access to health insurance through some other means, Pennie's here to help. Another very, very critical thing to keep in mind is, let's use this as an example. Let's say someone moves from Erie to Reading or from Reading to Pittsburgh. Well, in doing that, changing your zip code within the Commonwealth of Pennsylvania is a qualifying life event because in essence, what you're doing is you're changing one insurance market to another, and the plans are different, and it opens up that opportunity for individuals and families to come to Pennie and to shop for one that is specific to their region. Another important thing, individuals who may live somewhere else, say they live in Kansas or Colorado, if they move to Philadelphia, Reading, Lancaster, Pittsburgh, Erie, they can come to Pennsylvania. And moving to Pennsylvania, if it's a permanent move, at that point, that's a qualifying life event through Pennie. Two more things that are very important. Number one, individuals who gain lawfully present status. If they are here on a path to citizenship, if they are here on a student visa, worker visa, they can come to Pennie and they can shop for health insurance through us, okay? Also, individuals in the community who are released from incarceration, whether it's jail or prison, they have a special enrollment period and a qualifying life event. If they don't qualify for medical assistance or some other form of coverage, Pennie is here to help. So again, it's important that through our development here as a new agency, we prepare for certain things. You heard Juan earlier mention the fact that we now have local control of our health insurance exchange here in Pennsylvania. And that's significant because we have an event right now that goes hand in hand with the COVID pandemic. There was a public health emergency that was announced by the federal government. That public health emergency has protected hundreds of thousands of our friends and neighbors here in Pennsylvania who are covered under medical assistance. When the public health emergency ends, and it may end later this year, October 15th, it may end at some point if it's not extended into next year. But for right now, we're preparing at Pennie and at the Department of Human Service, we are preparing for the public health emergency to end this year. And when it does, there are going to be a lot of individuals here in Pennsylvania in communities that we all know who receive a redetermination on their eligibility for medical assistance. All right, Gabby, what's your question?
Okay, I'm asking in Spanish because it's more easy for me. Juan, cuando una persona sabe que va a perder su trabajo, que ya tiene una fecha determinada para perder su trabajo, ¿tiene que esperar hasta esa fecha de la terminación o puede solicitar Pennie desde antes de la fecha, sabiendo ya esa fecha que termina?
That's a good question. So basically, Nitsa is asking us if someone knows that it's going to be terminated or their employment will terminate in certain date. Do they have to wait until that day to get an insurance with Penny, or can they start the process before ending the work, the work and the insurance that they have?
Gabby, that's a great question. And the answer is they can begin early. And the reason that you would want to work with them early on is because on the day that they would lose, let's say today is July 1st. If a person knows that on July 30th, they'll lose their job and their health insurance through that job, we can work with them now to make sure that there's not a gap in coverage. The last thing that we want is to have a gap in coverage where a person goes uninsured. And believe me, there are a lot of people who make that choice. We want to make sure that we're working with them ahead of time so that we can get that protection for them before, before they lose their existing health coverage. In other words, you can set the application up in such a way that if they lose their employer coverage on the 30th of July, as of August 1st, they would be covered through Pennie. So hopefully that answers the question.
Nitsa, sí, la respuesta obviamente es que sí, y es importante hacer la aplicación o la solicitud de Pennie antes de que la persona termine para que haya una transición y no haya un gap, como dicen por ahí. ¿Okay? ¿Está bien la respuesta? ¿Queda claro? ¿Tienes alguna otra pregunta?
Yes, porque cuando yo estoy en el enrollment, el sistema me pide la fecha de terminación del empleo y me pide evidencia.
So that's important. That's important. Scott, so when she does enrollment, the system is asking her the date of when the job is going to be terminated and the insurance is going to be terminated. And if it's in the future, they cannot process the application.
Okay, well, in the event that you run into a situation like that, you would want to reach out to our customer service center at 844-844-4440. Okay. The reason being is because you can start working with an individual. You can start working with an individual before they lose their coverage. Okay. When that coverage is terminated, you want to be in a position where you can execute that coverage for that person. So my advice would be to contact the Assister helpline as soon as possible so that you can put those wheels into motion. Okay.
Yeah, that's a good point. Thank you. Thank you, Scott, for sharing that.
It's a common situation. Believe me, there are a lot of people who lose their employer sponsored coverage. And our goal here is to make sure that the application is processed in a way so that they have that coverage as soon as their employer sponsored coverage ends, they can pick up. Now, a key thing to that as well is I mentioned the 30th and the 1st, because many times what'll happen is someone will lose their coverage at the end of the month. Well, when they have proof that they have lost employer sponsored coverage, which is losing their job, at that point, you can start working with them ahead of time. And that way, when the coverage ends for the employer, they can pick up with Pennie coverage. And I will say this, sort of in follow-up, a lot of times employees like that will receive a COBRA letter. COBRA can be very expensive. With COBRA, there is no financial assistance, and basically the employee is picking up the payment, the cost of that employer-sponsored coverage. So at that point, Pennie can really help, especially if they're between jobs and don't have another job set up immediately, or set up a job in the future that doesn't have health insurance. They'll still be covered and they will qualify for financial assistance here.
So if anyone is in Cobra, that you heard in your community that someone is with Cobra, mention Pennie, because most likely we are way cheaper than Cobra, and our insurance that are actually better. So we definitely always encourage people that are in those transitions, they get Cobra. Hey, if you got Cobra, check Pennie, because we could offer something better for you.
Y aceptar cobra cuando mi empleador me lo ofrece, yo no estoy en la obligación de aceptarlo. Eso es opcional, right?
Correct. It's an option. You can opt, but always is very expensive for whatever reason. Unfortunately, Cobra is always very expensive.
Yeah,
so
I know.
you're right. Yeah.
Okay.
It's optional.
And that's a very good point, and that's something we should talk about, because a lot of times, especially, and this is where Cobra and purchasing Cobra can be a very high level concern for a lot of people. It's because they have pre-existing conditions. They may have certain treatments that they're undergoing. They may be working with certain hospitals or health centers where they're getting consistent treatment. They may be, under current treatment for a substance abuse problem, or they may have certain maintenance medications that are absolutely vital to them. They might be a diabetic, or they may need, some type of medicine to maintain their quality of life. For pre-existing conditions like that, there are a lot of people who will opt to pay a higher premium for Cobra just to have that reassurance that they can maintain access to the resources that they need. But again, pre-existing conditions are not a factor with Pennie. The customers can come to us and still shop, see what they qualify for in financial assistance, and ultimately have a choice. That's really where Pennie comes in. But the fear and the apprehension that people may have with regard, absolutely, that was a great question. But the fear and apprehension that some folks have with regard to, not having access to their current maintenance for their quality of life, that's a big concern. And that's something that, as an assister, I'm sure you'll face those questions as well.
Yeah, and thank you for the question, and we love to hear that. This is totally important for us to make sure that we talk about these subjects, and thank you, Nitsa. Scott, can you mention, this is very important because a lot of people are not aware that Pennie has this special open enrollment. Scott, what is the new Qualified Life event, 150% federal poverty level?
Right. And this is actually something I can provide an absolute update on. As of July 1st today, there's been a change to this, and I'll explain here in a moment. It was something we were very excited about, and I'll make sure to put the updates in the chat for you so that you have them. But part of having local control and in our anticipation of a lot of individuals here in the Commonwealth of Pennsylvania falling into that gray area where they may have once been eligible for medical assistance, but now, because they're working, because of, I guess you could say because of the inflation, there are a lot of our friends and neighbors who are taking on a second job. Well, when you take on a second job and report that income, you may now be just a little too much over what they require for medical assistance to qualify for coverage under medical assistance. But here's where Pennie is taking a step forward in terms of helping individuals and families who fall within that threshold where they're at or below 150% of the federal poverty limit. Now, what does that look like? If you take a look at the chart below, what you'll see is for an individual, a single person could be making $19,320 a year and fall into this range. You also have a family of four could be making $39,750 and fall into this range. The good news is that we have a qualifying life event created that will open a 60-day window for these individuals to come in, shop for and compare, and not only that, but to see the financial assistance they qualify for through Pennie. Now, the update is you'll see up in the very top of this slide where it says now available for new customers. Well, Pennie just literally this morning has enhanced this where new customers and current Pennie customers will be in a position where if they are at or below 150% from an income perspective of that federal poverty line, they will automatically receive an eligibility notification from Pennie that outlines the financial assistance, that outlines the fact that there's an account created for them here at Pennie, and that they can come and shop and compare plans to make sure that they're protected. This is a very significant event that's on the horizon with the ending of the public health emergency, but this is just another layer of the planning and communication that we're doing with the Department of Human Services and their operations people, their technical people, and our operations and technical folks here at Pennie to try and remedy this very, very significant population who, quite honestly, and I think everybody here knows that if someone believes that they cannot afford health insurance, they'll throw their hands up and they will be uninsured. And that's not something in this day and age, that's not something that our communities should have to weather. Another important program that came down the pike this year was the Path to Pennie. And the Path to Pennie is for anyone in the Commonwealth of Pennsylvania who files a state tax return. They have the ability on their state tax return to indicate that they're uninsured and that they have a desire to get insured through Pennie. When they check a box on that state tax return, it creates a form, REV 1882. Now that form is sent securely from the Department of Revenue to Pennie. And what it does is a few amazing things. Number one, it creates an account for that uninsured person here at Pennie. Number two, it sends out a notification to that individual informing them that a Pennie account has been created that they can claim. It also includes an estimate of what their financial assistance would look like. And it provides them with support information about assisters, brokers, and also Pennie's call center, how they can get in touch with folks at Pennie's call center. What's unique about this program is it was set up for the uninsured here in the Commonwealth of Pennsylvania. What's unique about that is that most people think that, well, you know, once April 15th comes and goes, well, so do people doing their taxes. But here's the interesting thing to keep in mind. Within the Commonwealth of Pennsylvania, you can amend your state tax return any time of year. So when you think Path to Pennie, think about the people who are uninsured. And again, this is something that through an amendment to someone's tax return, their state tax return, through that amendment, they can access coverage through Pennie. So
Path to
that's
Pennie is very important. It's kind of, you know, mentioned because I have been in conversations where an assister goes through all the qualifying life events and cannot find anything to help someone that is uninsured. And I said, well, do you know about the Path to Pennie? No. So Path to Pennie actually is very important because it's a tool right there. So if someone is uninsured right now, you can always get more information about the Path to Pennie, try to, you know, explain them because they could be could be a path to Pennie, literally, could be a camino hacia or a Pennie. So that definitely is something important, and it's a tool out of open enrollment. Now, this year we launched the program, and we hope the next year we launch it better, and every year we continue promoting it better. There was a question about if people are running into people that know Pennie or not. So our agency is 3 years old only. So there's still a lot of people in our communities that don't know anything about Pennie. Now, let me tell you, we have invested a lot of money in advertising, and we have partnered with many community members and organizations to try to promote Pennie. We have made partnerships, like if you have a license, for instance, you are a hairdresser, a stylist, or you have a license in Pennsylvania, any type of license, we send an email to all of these people, making sure they knew about Pennie. And we have been done many of these type of different activities to inform the community. We're doing that. Scott, Judy, and I, that's our job. Literally every time we have 5, 10 presentations a day with different community organizations about Pennie, because we know that people still don't know about Pennie. We want to make sure that they know. And that's where assisters and our network of brokers comes in, because we still need to do a promotion and talk to the community about Path to Pennie. There are plenty of opportunities. So this is work in progress. Pennie is not like Coca-Cola. Everybody knows Coca-Cola or these brands that are out there that always have been there. Pennie is new, so we have to, know what we are and improve on that. So there's a lot of room for improvement. That's why we need you. That's why we are happy to have this opportunity to talk to leaders like yourself, so you can bring this information to your communities as well. And this is exactly how you and your organization can help. Regardless where you are, if you are with Latino Connection, if you are with any organization, please, usually when we are Latinos, we wear different hats. So we are part of this, but we are also part of this organization. We also do this. Think about this. Anyone can come and request Pennie marketing materials at no cost. We're going to show how. Anyone can request a virtual or in person Pennie education session or a briefing. So you're in Pittsburgh with the Latino Center. Well, we can actually have a presentation like this one to the entire staff, if you guys think that that is important. Or if you're doing an event for the community, we can be there. We can go there literally and talk to the community. So there are plenty of opportunities where we can partner with you guys, so the chambers of commerce, all these different organizations that are out there. Or if you know that they are not connected with Pennie, right, but they could benefit from Pennie, just send us an email, connect us. We'll be more than happy to make this type of presentations. We do attend events physically as well. You can request information updates for newsletters. So we prepare the content, help you, so you can submit that. So, if you're launching an event, you can include a paragraph about Pennie. What is Pennie? If you have a healthcare event, it's important to talk about Pennie. Very important, because this is one of the biggest changes in the healthcare system in Pennsylvania in the last 3 years. So there are plenty of opportunities for us to talk about Pennie. Important as well for everyone. We prepare here at Pennie what we call a Pennie community partner work group. This is a meeting, a monthly meeting where we invite everyone, assisters, brokers, community partners, to see what is the latest updates on Pennie. And this is important because if you haven't heard about Pennie, this is a great opportunity to invite people. I show you how to get there, the information, where the meetings are, and where's the link. But every second Friday from 11 to 12 in MS Teams, and we will show you how to get the link so you can share it as well. And we have plenty information in. Thank you, Scott. You can share information on your social media accounts or your agency accounts about Pennie. Follow Pennie. That's another thing. If you don't follow Pennie, Facebook or Instagram or LinkedIn, just follow us and help us to spread the word, because that's what we do as well with events that you guys are organizing. So important as well is to know how we support our customers. There's so many people that we need to support. So we have different levels. One is our customer service. Very good. This is a very important and large number of individuals that are literally every day from 8 a.m. to 6 p.m. answering the phone during the week. And some of them are bilingual. They speak Spanish. And also we have a language access line that allow us to have or help more than 240 different languages. More than 200 people work in our call center. This is huge. The operations, we receive thousands of calls every day. And we have people literally walking through. If you have any questions about Pennie for end users, we have a 1-800 number that we want to show you. They can contact us very easy. Also, we have a network of brokers. This is important for everyone to know. Brokers are licensed professionals in Pennsylvania that can sell health insurance. Not every insurance company can sell health insurance. Some only sell car insurance or house insurance, whatever. But health insurance, there are some professionals that are licensed, and we have about 3,000 of them around the state of Pennsylvania. And they are bringing a lot of customers to us. So, but this is important because I want to show you how to find them. And there are also spaces where we don't have any broker or brokers don't speak Spanish. Bingo for small business owners. Great opportunity to serve your community is to create an insurance agency that speaks Spanish that can sell health insurance, because there's a lot of need for that. So this is important. Now, assisters, and that network of assisters is very important because usually it's our team. It's people that are here to serve the community, that have a very good relationships in the community, that work in outreach. Perhaps there are social workers. They work with nonprofit organizations or even for-profit organizations, but they are in engagement with the community positions, like yourself. So you can help us literally to be unbiased. And that's a big difference between brokers and assisters. So as brokers can sell health insurance and can tell you which one will be better for you. Assisters are unbiased. Assisters don't sell health insurance, but assisters can help customers to navigate and to choose, what are the options that they have. So this is important. What are the different personalities as well from the assisters and the brokers? But both groups are extremely important for Pennie. Finally, you can navigate our website, and that's actually what we're going to do right now in the next few minutes, because it's very important for everyone to know how easy it is to navigate our website. So I'm going to go ahead and show you our website. Welcome to pennie.com, not pennie.gov. Pennie.com. Even though we are a government agency, we wanted to make a more accessible and friendly use for everyone. So finally, we decided to go to pennie.com. That's where we are. On the top right, you have the customer service phone number of Pennie. And in the left side, you have a phone number exclusively for assisters and brokers. So like Nitsa, if you have any questions next time, or anyone here have any question, the phone number that you're going to use is brokers and assisters is 1-844-844-4440, different than the regular 1-800 number for customers, which is 1-844-844-8040. Okay. Here's our website. It has a very important tools. Before we go anywhere, if you go down, if you click here, this little window, right, you have different languages that you can translate the website. Or let's say Espanol, and the website should be translated in Spanish. Some images are not get yet, but we do have the ability to show customers in Spanish our website, which is important. So we have even the events are listed here, upcoming events. So we know that Lunes, Servicios de Salud Alder. I think this is Dauphin County, correct? Partners, sister partners are doing an event there. So you can actually look at here the details of that event, literally, and know that, yes, in Harrisburg, in this location, they're going to have an event from 4 to 8 on July 4th. This is very interesting because that's the idea, is that we can also publish all your events that you have here with Pennie. So this is important. We're going to go back again. There are different languages because Pennsylvania is very diverse. Not only speak Spanish, but French, and there's a lot of people that speak different Chinese, Russian. So let's get back to English for now. So I continue, just show you, we have videos, very important information about the programs, our plans, but I want to show you a few things. So you can click here and again, go back to our 1-800 number. Brokers. There's a directory here of brokers. So I want to ask, if we click here, find a broker. Josie, could you please tell me what is your zip code there in Berks County? Josie is with us?
Yes, I'm sorry, I was muted. 19602.
19602. Oh,
Yes.
19602. Okay. So this is important. So we're going to find someone that speaks Spanish and is a broker. Okay. So what is showing that in Berks County, there are 2 individuals that are licensed brokers that can sell health insurance. And these are their information. So I can see Miguel Torres. Miguel Torres speaks Spanish. This is where he works. So I can call him, right, and make an appointment. This is information is important, even though you are planning to, or you want to become an assister. I think it's important for you also to know that we have brokers and what is the role of the brokers. Okay. So if you don't select the language, and you just hit, we have 22 agents in that area next to that zip code, literally, that can help. So we have brokers in many places, in many different counties in Pennsylvania. Now, coming back to our website, okay, here we're going to find assisters. And we know the difference between brokers and assisters. Let's check what type of assisters do we have. 19602 in Berks County, 5 miles around. And let's put this, that speaks Spanish. So we're going to see who are those assisters right now there. So we have here one organization only with 4 different locations, but it's literally Berks Community Health Center. This is a great thing because there's a lot of opportunities for other organizations to have assistants or assisters. So at this point, Adriana Munoz in Berks County, in Berks Community Health Center, she can, you can call her, you can request an assistant, you can request an appointment, you can email her if you have a question. So this is why it's so important to be listed in our directory. Now, some of them, and this is important, some of them have hours of operation. So if even, like, say you have another job, but you also are an assister, perhaps you have a few hours during the day that you can post it and let people know when are you available. This is pretty important if you are an assister. Why? Because as an assister, you have 2 ways. You have to go out and do outreach and talk and find the uninsured. But also during our website, you will receive a lot of leads. You will receive a lot of calls from people that are uninsured and want you to help. So at the end, we want you, the assisters and the brokers, to increase the numbers of enrollees. We want that maybe in 1 year, each of you can say, hey, I enrolled 20 people, I enrolled 50 people, but those numbers are important. So this is a lead generator, our directory, and you can add the hours that you are available. So just think about it. George, I don't know if you're still here, but that is an important point that I think that will benefit your organization if we can at least have some assisters listed in the directory. Just think about it.
Yeah, and it's something that we've talked about in the past with Karen. It was never, our relationship with Cognosante was not meant for us to be listed as an assister, because we were more, I think the first year we were more just out doing branding. I think that we can look at that. So Gabby, when we have our call next week with Cognosante, let's look at that again. Thank you, Juan.
No problem. Thank you. And I think that it could be very beneficial for you guys as well. So, and we also have, okay, now this is the next 5 minutes are going to be perhaps the most important part of our presentation. How easy it is to navigate our website. We always invite people to come to the yellow button that says Get Cover. This is how anyone can see if they qualify or not for financial assistance. So if you're with someone, you know, a friend or someone in your community is looking for Pennie, in your phone, literally, you can show this. It's very easy if they qualify or not for financial assistance. So you go to the yellow button, click Get Cover, and then you come to this menu, and then you click Browse for Health and Dental Plans. But here, right here, you can do it in Spanish. So, explorar planes médicos y dentales. Compre primero, regístrese después. Let's go back to English, browse for health and dental plans. And that's what we're going to choose, right? And then here is important because it directs us to a Pennie plan comparison tool. Okay, so we click here, and the system asks us for, like at the supermarket, at the entrance of the supermarket, it will ask you for 4 questions, right? Very simple questions. So we have a zip code, and we have one that Josie provided us in Berks. Okay, they ask for the applicant date of birth. So I'm going to put something fictitious for now. Okay, and then if you want to add, because this is your household, your spouse, or your dependents, you can do that and make sure that everyone has a blue mark. And then see an estimated income, say $27,000 for now. Look at this. Only 1, 2, 3 pieces of information were requested. You have to put your name, your phone number, your email, nothing. Just pieces of information to see if you qualify or not. This is huge because we can help a lot of people in conversations. So see if you qualify. You click here, if you qualify, and there you go. There are 2 types of financial assistance that Pennie can provide. The first one is called Advanced Premium Tax Credits, or APTC. Okay, that lowers your monthly premium. So this is important because this individual right there in that zip code will save monthly $535 a month. That's the financial assistance that it can be provided a month. This is significant. This is a lot of money. Also, if you choose to have or enroll in a silver plan, Scott mentioned that we have different levels. So if you enroll in a silver plan, okay, you may also have a second type of financial assistance that is called cost sharing reductions. Cost sharing reductions. So that second financial assistance helps to lower the deductibles, the co-pays, those out-of-pocket costs, that are also part of the health insurance plan. So those are the 2 different types of financial assistance that we can provide. And then we do next, and our system helps you to filter by doctor or by facility. If you really need a doctor, you check that the plans that at the end are going to be selected include that particular doctor. Or if you have a prescription drug, something for diabetics, something for many of these health related issues that many of the Latinos suffer, and you have to have a prescription, a medicine that is a prescription, so you go and check for prescription. Now, let's say for now, skip to view the plans. And here is the supermarket. Here is the marketplace. Here is Pennie. Pennie is the platform. And the health insurance providers are here with different health insurance plans that you can choose. So let's take a look at this first one from Highmark. Okay, Highmark. But just if we read careful, this health insurance plan will only cost $1.89 a month, but after $552 tax credit. That tax credit is the financial assistance. But at the end, when you choose or select any of the plans, that financial assistance will be applied, and at the end, you will be paying little money or a lot of less money than the health insurance plans. Now, you can go out of the supermarket and go directly to Highmark or Capital Blue Cross or any of these companies and pay 100% of the rates. That is also good. If that is your option, you don't want to help, that's fine. You can go and have a very high quality health insurance, right, with a different rate because they don't have financial assistance. That was why it's so important to work with Pennie. And that's why these companies also are in Pennie, is because we can provide that financial assistance, therefore bring more customers to the health care system as well. But there are, again, there are options. So Scott was saying before, some people look for zero deductibles. So you can literally filter for zero deductibles. And these are the plans, a little bit higher the premium, but still very reasonable amount for people to have access to health insurance. You can compare, you can have a lot of more information. And if you don't know something, like a deductible, I don't know what a deductible is. You can just literally put your cursor of the computer, right, the mouse, on that word that is, you see the dots, and then the window will pop up with the explanation of what that means. So deductible is the amount that you pay for cover services before your insurance plan will reimburse any expenses for in-network services. Not all payments count against the deductible. So those are important things that we need to talk with the community. So if you have any questions here, help and support right there. There's a 1-800 phone number, again, where you can call as a customer and find information. You can contact or find local assistance. And here again is where you have the opportunity to be listed in the network of brokers or assisters and then ask for help. But for your information, there are.
I hate to interrupt, but could you click on the translation widget up in the upper right-hand corner and show that you can also translate this into Spanish?
Thank you for saying that.
Yes, sir, because that becomes an important thing. Health insurance is so complicated. To be able to actually approach someone in their primary language with regard to health insurance is incredibly important. So please understand, this plan comparison tool is with a click of a button. You can translate that. For right now, in our platform, we have English and Spanish. So that's what we have available, but most definitely it can help.
Thank you so much. This is important. Now, please know that there are 41 planes de salud or health insurance plans, and also we sell dental plans or planes dentales. So this is important because Pennie, if you look at the dental plans, are very affordable, and you can buy dental plans or medical plans or both in Pennie. This is important. Look at the numbers: $6, $9 a month for dental plans. And then again, it's important because you can look at the entire plan and you can compare different companies. This is what competition is about it. For real, this is why it's so good for Pennsylvania to have competition. These insurance companies are competing in the marketplace. So for a customer, it's safe. It's good to be using Pennie. And this is something that we need to relate to the communities that we work with. Any questions so far about this Pennie comparison tool that we have? Please unmute yourself because this is an important part of our presentation. Okay. Any questions? I don't see anything in the chat. Let me go back to pennie.com because there are a few things that we want to still help work with you. Are this. So you can learn right? So here is the path to Pennie, videos, frequent asked questions, okay? You can shop, overview, saving calculator, financial assistance, get help. But here's something very important, support. Support for whom? For community partners, for brokers, for assisters, and we have other programs. Let's take a look at community partners. Community partners are any organization. Latino Connection is a community partner of us. Any organization, a healthcare is a community partner. A church is a community partner. A small business, a community partner. A community organization, right there. So anyone that wants or work with community members can be a partner or a community partner at Pennie. So we have tools that are available to you guys so you can share more information about Pennie. Here, you can have access to Partner Resource Library. This is important because you can literally come here to our website, download Pennie handouts and flyers. Look at this one, for instance. There are plenty flyers and palm cards. This one is for a small business. So let's say you have an event for a small business and you want information on Pennie directly for them. So, but you want in Spanish. So you click here and voila, Pennie y ustedes y sus empleados. So there's literally some marketing materials that you can use, okay? And you can literally explore. And I invite you to go, if you're an assister or broker or anyone related to Pennie, please go and look at all the resources that we have, because literally you can request them. So we have different marketing materials, and if we don't have one, you can literally request, tell us, and we can try to figure out, and do it. But this is important. There is a form under that, the request free print marketing material. So you put your name, your address, okay? And then there are even more products that we have. See that you have a community that speaks Korean or Nepali. So you can also request some of these marketing materials, right? And you say maybe 50 of each. So you write, 50 of each, and then you submit. And then Pennie, at no cost to you, will send you to Pittsburgh or Reading or Harrisburg, anywhere you are in Pennsylvania, our marketing materials. This is important. You should have marketing materials at the places that you have engagement with the different communities. So this part is important. We want to share that. Then become an assister. Okay, we invite, again, we always in outreach are making presentations and inviting different community organizations to become part of our assisters network, because there is a need for that. There's a lot of counties where we don't have assisters, and many counties that we don't have assisters that speak Spanish, for instance. So we want to make sure that we always invite people to become an assisters, and they can get more information to become an assisters in general. There are two types of parts that you need to be aware. One is that to be an assister at Pennie, you have to register with the Pennsylvania Insurance Department. And here are the step-by-step, how do you register with the Pennsylvania Insurance Department. Once you register, and this process has to do with fingerprint and other important information, and to be able to register, because assisters may go and visit people at their houses, so they want to have this level of security that if you are an assister in Pennsylvania, you have been passed certain requirements. Okay, so you have to register with the Pennsylvania Insurance Department. That's another government agency. It's not Pennie, so it's important to think about that. And then you can also request, if you go to support, if you go to assisters, okay, then you can request here a training. So let's say that you are new, right now you are not an assister yet, but you want to become, you come here and get certified. So you request the training. And when you request the training, you put your name, your information, okay? And every year assisters have to do a refresher training. So you can do that. Or if you're a totally new assister, you click here and you submit. That is important to know because that's how you get your training as an assister. So let's go back to our pennie.com. Okay, and here is important. We are still under community partners website. Then join the work group. And this is important. We need to have people from Latino Connection attending these important meetings every month. At least a few of you guys are important. If you have the opportunity, or any partner, any community partner is welcome. And here this is no access. There's no password, anything weird. You can just click here, literally, and this tool is available for everyone. What is the tool? The dates, the agenda, and once the meeting link. And once the meeting it happens, like in this particular case, we have 2 meetings that already happened. So we provide a recorder, meeting recording about it. So we film, and that is available here for anyone to see what happened last time. And also we have a meeting deck or the PowerPoint presentation that we use there. And most important, we have questions and answer documents, that you can click, because there are a lot of questions that are common for assisters or brokers. For instance, how do we upload to a DMI ticket, right? Those questions, these are very important resources. How you calculate income, and we go in the details. We create these documents because these are important tools for everyone, for our assisters network and also for our brokers. So we do the trainings, but there's a lot of marketing materials and information here that, look at this, path to penny. When does the path to penny end? Okay, this is very important information that will help you to prepare better for penny and to serve the community. That's basically what it is. So we always encourage people to come here to our community partners website and play with this. All of you guys that are here in this meeting today, we consider you already a community partner. So we invite you to share more information and continue learning, because at the end, if we help to reduce the number of uninsured individuals in your community, you will be benefit as well. Everybody will win, and that's exactly what we need to make sure. That's the best way that Pennie can help your community, is if we provide the financial assistance for the people that you serve, for the people that you know, for the people that needs our help. And that's why we have to work with community partners. Otherwise, it's going to be impossible for us to do this job. We are trained outreach. Scott usually covers the part north of the state of Pennsylvania and west. Judy, who was not able to join us in the meeting, Judy is now in Lancaster, Harrisburg, Central Pennsylvania, York, Reading. And I was there before. Now I moved to Philadelphia. So I'm literally working closely with partners, community partners in the Philadelphia area and the Philadelphia counties. Anyway, we are state employees, so we go across the state and we help each other. But we cannot do this alone. We have to have partners. We have to have community partners, assisters, and brokers being engaged in this. So any questions so far before we do a little quiz exercise here? Any questions so far, please unmute yourself. I'm going to stop presenting, and I'm going to prepare my question that is going to be fast, but this question, the quiz, is going to be very important. So pay please attention, because here is where the experts can help us. And I'm going to look at the chat. I'm going to put the question here in the chat, and I want to ask you for your help to answer carefully this question. Hey, Angela, we haven't seen you before, but hey, welcome.
Thank you.
Welcome. Where are you, Angela?
In Reading.
In Reading. And who are you working with?
With Josie and Angel.
Perfect. Well, welcome to the team and welcome to the presentation. We record it, so you can literally go back and see the entire presentation. And here is the question. Please help me to answer this. Let me see if I can. Okay, this is important. Ding. Based on your personal experience, and I have experts here that have been working with Latinos for a long time, what would be some of those best practices for outreach and engagement to Latino audiences? Just give us some ideas. Share with us some of your ideas. What has worked for you? You have been working for years with Latinos in different things, in different companies, in different organizations. Tell us some of those best practices that you think work better with Latino audiences. Anyone?
So I can speak. I don't have a lot of experience. I told you that I'm only 1 month in Latino Community Center in Pittsburgh. But for my experience, I think testimony of people who are already enrolled in Pennie will help the community, because sometimes like knowing that someone that is near you, your neighbor, know about Pennie, there's a lot of hurry. So people need to trust. So I think that's a big. So I think that it would be like a good idea to have testimony in the community to share that how Pennie works and how it works for them. So
that's a great observation, Vicky. Thank you so much. Very applicable.
Yeah, and Vicky, just so that you know, we did a very recent marketing survey to find out how people were finding out about Pennie, and at the top of the list was word of mouth. So I absolutely concur with that.
Nitza.
Juan, ¿puedes hacer la
Gaby.
pregunta en español, por favor?
Claro que sí. ¿Cuál crees, basada en tu experiencia personal, cuál crees que son las prácticas mejores o las estrategias mejores para acercarse a la comunidad latina y presentarles, por ejemplo, conectarse con ellos y hablar acerca de seguros, por ejemplo? ¿Qué tipo de prácticas han tenido ustedes con éxito que les ha ayudado a acercarse a la comunidad latina?
Los tables event que nosotros hacemos de educación, donde les presentamos a la gente lo que es Pennie y lo que ellos pueden obtener a través de Pennie, ofreciéndoles ya sea la información verbal o escrita en todos estos table events, donde se reúne la gran mayoría de la comunidad latina.
Tienes toda la razón y eso lo apreciamos muchísimo. Yo incluso me acuerdo que cuando te conocí, ustedes colocaban un table event in a restaurant. Yeah. So to meet people where they live, where they eat, where they pray, where they work, it's important. So I remember Latino Connection. It was very interesting for me. First time I go to a restaurant and you have a line because that was a very successful restaurant. So you have this line of people and they come to the table, they want to have information. Mm-hmm. So meet people where they are. Bodegas, and I know you guys have different programs to be there in bodegas and restaurants and churches and places. Important. So thank you, Netza, for your comment. Very, very important, and we recognize the contributions of Latino Connections specifically for that. Because I that's where I met you, and it was great to see you guys working with the community and helping Pennie. Any other idea, Angela, Josie, any of your personal experience? What are the best practices for outreach and engagement with to Latino audiences?
Well, with me, I haven't had the experience yet. Just with Josie, because I still haven't have my license or whatever, but only one event that I did, and I saw how it works. Just the other day, I gave some information to someone about Pennie because they didn't know what Pennie was, and I gave them the pamphlet, and they say, "Oh wow, I didn't know about this." So I felt good giving the information and explain them a little bit about Pennie. And I say, if you want to know more information, I gave Josie's information so they could get in contact with her. And it felt good.
But in general, Angela, you have been working with the Latino community
I
for
have.
years.
Oh, I have working
Tell
with
me
community.
some of those things that you think work for
I have
Latinos.
working with the community for a long time, with Josie and Angel and everybody. And to me, the most important is to get in contact with them, talk to them, and explain to them how everything works, because you have to give them the approach and give them the information, because a lot of the community here doesn't know a lot of the things. Like I said, when I approached that person, because I was giving some information and I took out the pamphlet, and they say, oh wow, this is what's Pennie, what it is,
Yeah.
and I gave them the information.
That's true,
So-
Angela. Thank you. And they said that Latinos, you have to take their hands
by the hand, you
and
have
walk with them.
yes.
So that is exactly what I remember, and it's important. Those are
Yes.
strategies that perhaps white people are different. People are more independent, but if they can do themselves everything, they can
Yeah.
figure things out. But our Latino community requires a little bit more of effort and create these spaces. So first, what is your name? Where are you from? I mean, like this type of first interaction, because we need to know each other first before we jump into hot stuff.
You have to take them by the hand, and
Right.
it takes more time to
More
work
time and more
with the
effort.
Latino
Absolutely.
community. You do.
Nitsa, I saw your note about George. No worries. We thank you, everyone. We know are a little bit over the time that we have for this training. But before I close, is there any questions that you have right now for us? Please know that we are always open. You can text us, you can email us, and I'm gonna write my email address here. Any suggestion, events, activities, questions? I mean, we're here to help. This is what we love. That's what we get paid, literally, to support our teams. So Scott, Judy, and I are here. Please invite us to your events. I mean, like literally, if you have an event, invite us. We would love to participate, learn more about your communities, make sure that we can support you. That's important. So we are here to support. So again, anybody has any questions? I don't see anything yet, but feel free to always reach out to us. Nitsa, you have some questions. Go ahead.
No una pregunta, sino que les quería comentar que una de las cosas que nos hemos percatado es que debemos reforzar el hecho de que la gente conozca que el periodo del Qualifying and Live Event tiene solamente 60 días, porque mucha gente cualifica para esos Special Enrollment, pero no saben que tienen solamente 60 días, y cuando vienen a reportarlo, ya se han pasado y entonces no pueden hacer su enrollment.
That's a good point. Qualified live events have only 60 days to use it. If you don't use it, then you cannot use that qualified live events to get enrolled. So thank you for that point. Thank you so much, everyone, for participating. It's a pleasure meeting you, many of you for first time. We're here to help. Thank you so much for being here today. If you didn't attend the entire training, feel free to look at the record that is going to be shared as well. Call us, ask us. We're here to help. Thank you so much in the name of everyone at Pennie, because we are like 45 people in Pennie. We are all literally with one focus, is to support customers and to support the people that help us to work with the customer. So we're here to help.
And my apologies coming in the meeting late. I was in another meeting.
No worries. We totally understand that. You guys are busy.
Yeah, we recorded the session, so everybody's gonna receive a link to the recording. And again, I can't echo Juan's expressions enough. If you need help, our contact information is there. You can email us, call us, reach out. Okay?
Thank you.